My name's Caitlin, and I'm an operating nurse here in Boston.
My name's Pete. I'm a firefighter and EMT.
So how has COVID-19 impacted your work?
Um, for us, we're a lot more conscious about cleaning and PPE. We always were in general, but now it's to the point where every time we touch anything, every time we get in the truck or come back from a run, we're always washing our hands. And people are sort of looking out for each other too, making sure that we're keeping the fire truck clean and we're doing a good job washing our hands and wearing the proper PPE on calls. And sometimes we'll get out of the truck thinking this is pre-COVID and just be wearing our gloves. Now we sort of look out for each other and make sure, like, hey, put your glasses on, or make sure your mask is on, and we just do a better job making sure we're all in the proper safety equipment.
Yeah, so I feel like teamwork, everyone sort of became united, even at the hospital and probably at the firehouses too. It definitely has brought people closer in a way, all supportive. But at the hospital, I can say like PPE obviously increased for us too. We have a lot of requirements, visitor restrictions. For us, we have to pass a little online test, if you say, just to come to work. We have to show it. It's like a cleared pass. And then everyone has to wear a mask throughout the whole day. For me in the hospital, I was never deployed from my unit, but plenty of other nurses have been moved all over the hospital to units they've never worked in before just to offer support. Even if they're not the primary nurse or the primary person, everyone is picking up more than their share and helping everyone in any place needed. So that was probably the biggest impact, I feel like, specifically relating to staff members. Oh no. We can't hear you.
What is one thing you wish people knew about working in your roles during the time of COVID-19?
I think it's probably what the message has been to everyone. Like, this is serious. People are dying. I know there's everyone's getting sometimes mild symptoms, but it is very serious. And just to stay home and stay socially distancing from everyone, because it does help us. If there's less people, you know what I mean? Like we're going to work, we're exposing ourselves and our families to potentially getting sick. So we appreciate everyone who's following all the guidelines that get to stay home.
Yeah, and for us, you got to remember when you call us, we're going to come in your house and we're going to spread any germs that we may have. We're going to pick up any germs that you may have. And then when we go on the next call, those germs are going to continue to get spread. So just remember, obviously, I'm speaking out of my own personal opinion. I'm not talking on behalf of the fire department. But if there's things that you could maybe handle by calling your healthcare provider instead of calling us and having us come in your home, that might be a better option as opposed to exposing more people potentially unnecessarily.
And how do you think COVID-19 is going to change things for you or for others in the future, especially in regards to your work?
Well, there's definitely going to be this new norm, I feel like, for a while. So we're slowly starting to transition and open in the OR, specifically more rooms and starting more cases, elective cases. But it's a slow process, and who knows how long that's going to really take. I don't know if anyone truly has the time frame. And I think in general, outside of the hospital or the fire department as well, there's going to be a new norm for everyone, an adjustment period. But eventually, like every other thing that happens in life and over history, we'll get back to the way things were.
Yeah, I think the same sort of what we're living in now is going to be the case for the foreseeable future. And for us at the firehouse, it's not a huge deal. I mean, normally sitting around the coffee table in the morning and talking about your shift before or what you have coming up next day is sort of a social event. And we're sort of trying to limit that. And it's not as exciting. It's kind of boring when you get relieved. You just go home. But it's what has to be done. And I think that's the way things are going to be for the immediate future. Let's see what the winter brings. Already we're talking about winter.
All right. Well, thank you very much.
All right. Thank you.
Sure. My name's Matthew. I work part-time in a grocery store deli. Um, it's a full-service deli, typically. When everything kind of went south with things getting locked down and, you know, state and local governments kind of flailing around trying to get ahead of something that they were already behind, it went from full service to all slice ahead, wherein we would slice a selection of meats and cheeses and put it out in a refrigerated case for people to peruse and select what they want and walk away, as opposed to everyone just coming up to the counter and ordering, what they wanted, cut a certain way, and how much. So that was the biggest and most drastic change, as well as the limiting of hours at the store for customers to be actually, in there and whatnot. But the biggest change was going from full service to prepackaged.
There any other ways that COVID, the pandemic, impacted the work there?
Supply chains are a nightmare right now. Things are kind of getting back to normal for things like produce and a lot of grocery store a lot of general merchandise items, but some things you can't get, like yeast, toilet paper, and the meat supply. The meat supply for the meat department has kind of leveled off. It's a lot more prepackaged and a lot less cut in store, but for what we do in the deli, it's still a nightmare. We get roast beef on our load like once a week, whereas before we'd get it a few times a week and we'd go through all of it. And now we go through all of it in a day, and then the next day someone's like, "Hey, do you have any roast beef?" "No, last time I had roast beef was yesterday." "When are you gonna get it back?" It's a good question. Our selection has gone way down. We used to carry literally dozens of products across a couple of different product lines, and we've gone from dozens to like less than a dozen in one product line and just over a dozen in the other. And all of the specialty stuff is not available to be cut in the deli. So you can get Genoa salami and hard salami, but if you're looking for sopressata, then I got to direct you to another part of the store for that. If you want prosciutto, I can't cut it custom. Sorry. I just don't have it. What else you got?
Is there one thing in particular that you wish people knew about what it was like to be working during this time?
Yeah, so it's pretty stressful for the workers to be basically in the presence of dozens or 100 or more hundreds of people in a day or in a week, and have some of them taking this seriously and some of them not, because we have to take it seriously for all of them. But I wouldn't say a lot, but because there's more now, but especially at the outset, there was probably less than 50% of people who were taking it seriously for other customers, themselves, and us as employees, and complying with mask usage and wearing gloves and keeping a respectful distance. And if they're not doing those things, then I know they're not washing their hands for 20 seconds and at regular intervals. And so basically I have to look at, as opposed to before when I would look at a person walking up to my counter as a customer, maybe it's a regular, somebody I know I've interacted with over the course of time, I would consider a friend. If I saw them on the side of the road, I'd stop and help them change the tire or whatever. Now even those people I have to look at as disease vectors, and they're coming up without a mask, I have to stand well back. If they ask why, I have to tell them, you're not wearing a mask, and I'm not going to come closer until you are. I had to tell a customer this week that, like, whoa, why aren't you cutting this? Well, you need to step back or put on your mask, or both. So yeah, I wish people would know that we are very aware of the risks to us and to you, and we wish that customers would take it as seriously as we have to.
Okay. Last thing, how do you think this is going to change things for you, or the store in general in the future about how you do business?
I think some things are going to go back to the way they were. I think that we're going to start carrying the supply chain is going to even out, and we're going to be getting different products in more regularly, and our selection is going to expand. I think over the medium term, masks are going to be a thing, as well as staying away from people. The one-way aisles in grocery stores are going to be a thing. If they're gone before Christmas, I'll be shocked. I think that there's a lot of sanitation practices. We do a lot of extra sanitation in the store, where we sanitize touch surfaces. I wouldn't say obsessively, but very regularly, to make sure that it's safe for customers and for us, because we have to touch those surfaces also. I think that's going to continue well into the future. That might not ever ease off. I think that a lot of things will return to the way they were, as far as the mechanics of the job. But I think the sanitation procedure, and I don't know that anyone's ever going to look at somebody standing close to them quite the same way. It's going to take, like, children who 5 and up, I would say, are going to remember this, and they're going to somebody standing too close to me, and they're going to kind of move away. Like, it's going to be a few years before there's any number of people who are unaware of the presence of other people the way we were before.
Okay. Anything else that you want to share?
Well, thanks very much for taking interest in the service industry, because there's a lot of people in the service industry out there, and they are forgotten unless they're needed in a lot of cases. Folks want their coffee, but after their coffee, unless you know the person personally, you're probably not thinking too much about how they're doing on the day-to-day. So having this recorded for others to watch and think about in the future, I think that's important.
Hey.
So I appreciate it.
Great. Thanks for your time. I'm
Thank
going
you.
to go ahead and stop the recording.
Yes, so my name is Deborah, and I'm a neuro-oncologist at Massachusetts General Hospital. And so what a neuro-oncologist means is that I provide care both inpatient and in the outpatient setting for primarily patients with brain and spinal cord tumors, but also those who are struggling with neurological complications related to their cancer.
Can you tell me how COVID-19 has impacted your work?
Yeah, so, the ongoing COVID-19 pandemic has really just changed things in every way. For those of us who are working in healthcare in an academic medicine setting is a completely different world. Daily work looks totally different than it did in the pre-pandemic setting. There's been an incredible amount of new and constantly changing information and policies that are being disseminated to healthcare workers on a daily or sometimes multiple times a day basis. And so everyone's had to become very patient and flexible with ourselves, with each other, with our patients and their families, because it is sort of an ever-changing time. Everything that can possibly be converted to virtual format is being done that way. But at the same time, with schools closed and daycares closed, you're seeing so many healthcare workers who are juggling new and different responsibilities on the home front, in addition to kind of the change in the way that they're providing care. And we've really kind of rapidly rolled out new and innovative ways to provide ambulatory care for folks through telehealth, and that's been quite different. Whereas before we used it to some degree, now the majority of visits, at least in the cancer center, are being done over telephone or video formats. And then in terms of patients in the hospital, I think the biggest impact that I've seen is related to the visitation policies, families not being able to be there while their loved ones are sick and are going through hard times. And I think that that's really had an impact on the patients and families, and also on the providers.
What is one thing you wish people knew about working with or during the time of COVID?
Yeah, so I think that the one thing that I wish that kind of the general population were more aware of is that for those of us who are taking care of sick patients, that the care of patients without coronavirus infections who are sick, or the care of patients who are infected but have other pressing issues, is just as important as treating people who have coronavirus infections. And I think one of the things that many of us are worried about is that we're seeing dramatic change in people who are coming in for things that we consider to be treatable and urgent. So as an example, there was a really interesting piece in the New England Journal of Medicine earlier this month about strokes, and that there's been almost a 40% sort of very sharp drop in the number of patients who are presenting to get urgently evaluated for strokes since all of the social distancing measures were put into place. And so I think a lot of us worry that while everyone can and should try to stay as safe as possible, that a lot of people are deferring getting medical attention for things that we think we can provide safely and effectively during this time. And I think that there's a big risk that there will be a second surge after the viral surge of patients who are coming in really sick with illnesses that are more advanced than they would have been, partly related to people being afraid to seek care, and partly being related to restrictions that facilities have had to place on things that were felt to be not as urgent or emergent. So I think that there's not as much information out there about that, but I feel that it's very important.
And my final question for you is, how do you think COVID-19 will change things for you or others in the future?
Yeah, so I think that there are a lot of ways that I could answer that question, but I think in terms of work, that COVID-19 is going to change dramatically the way that we think about delivering healthcare to patients. I think that telemedicine, being able to provide services by video or kind of as the backup through telephone, is going to take a much more prominent role. I think we're already seeing changes in reimbursement for those types of services being sort of more readily accepted and available. And I think that patients, families, and providers are going to be thinking a lot about which visits we really need to see somebody in person, and when we can substitute telephone-based or video-based visits. And our hope is that we might be able to leverage this to actually provide better access to care for people who live in an area where there's not somebody who specializes in their illness, or they lack resources to travel or are too sick to do that, and that there might be ways that we can actually deliver these services using virtual means and thereby expand access to care. In the oncology world, we're hopeful that we can leverage it to open up clinical trials to more patients who are outside of kind of our immediate catchment area, whereas historically there have been a lot of limitations on that. So I think that all of those things are really going to significantly change.
Well, thank you.
Okay, so hi, my name is Rona. I work in a large urban Department of Public Health. My background is in nursing, and I'm the clinical coordinator of a team called the Bioterrorism Public Health Preparedness Team, which is a long way of saying that I am part of a team that responds to emergencies that have to do with the public health. And so what I wanted to do was make it a little more clear about what public health work is compared to what you're hearing about now with respect to the response to COVID-19. What you read in the paper, and not to minimize the importance of this, is that you hear a lot about frontline healthcare workers and all the difficult, almost dangerous work that they are doing in this situation to be able to care for people who are sick. But a lot of what forms their ability to do the work has to do with how Department of Public Health like mine provides them with the guidance they need to be safe. And the difference between their work and our work is that there is an army of people behind the scenes who are helping with the planning, the guidance, the surveillance, and all of the concepts that have to do with how the healthcare system, how the public, how the city responds to this crisis. We're the guys who inform all of that work. And so even though, you will hear about those first line responders of all kinds, those are the ones that certainly deserve attention. But behind them, there's this whole group of people working really hard, 7 days a week, sometimes even 24 hours a day, to make sure that our population is safe and that they know what they need to know to be safe. So before COVID started, our work was basically around planning and exercising to theoretical emergencies, things like an anthrax dispersal scenario and local outbreaks of diseases like hepatitis A. So we did respond for real to those kinds of issues, but mostly we were doing planning and mostly we were exercising our plans. We did planning for pandemics around issues like medical surge. What that means is that we anticipated and theorized what would happen if a certain number of the population got sick. How would that affect the healthcare institutions? We were always answering questions like, what would we do if? And what would our city's capacity be to provide the kind of response to an emergency that would affect an entire population? So here we are right now with a real situation that takes us out of planning into trying to respond and use what we planned, but also finding out all the places where there have been gaps in our planning, things that we could have never predicted. One of the things we did learn, and we kind of knew this ahead of time, but it was verified for us, and I'm sure it is true where you live as well, is that any response to an emergency, whether it's a public health emergency or any other emergency, really starts at the local level. The cavalry is not coming to rescue us. And so everything that we need to do to make sure that our population is safe, that our healthcare systems and our healthcare workers and our essential workers and our infrastructure employees like utilities, that they know how to behave and they know how to stay safe in a situation like this. And so I just want to make sure that you understand the nature of public health work. So in our office, for instance, There are various kinds of activities that are going on a daily basis, again, behind the curtain. And so I'll just name a few of those. Whenever you hear about testing and testing coordination for COVID-19, a lot of that work has to do with how the Department of Public Health works with agencies to make sure testing happens, to make sure organizations have supplies, and to get the results of testing so that the next phase of our response, which is called contact tracing, that is being able to figure out who's been near someone who's infectious and warning those people and making sure that outbreaks don't happen. All of that is within the purview of Department of Public Health. We have many epidemiologists who take a look at the trends, who try and identify where there is trouble and where the response needs to be directed. We work with hospitals and with nursing homes in congregate settings, shelters, behavioral health facilities to determine whether they're safe, whether their processes are safe, whether they have the equipment they need to protect themselves, and how we can help them control any outbreaks that they have. And I'm sure you have heard that nursing homes in particular, where there are the most vulnerable population, are really struggling with COVID-19. And so we are working very closely with our nursing homes to see if we can help them get through this. We talk about public guidance. Everything that you hear coming out from the CDC, the Centers for Disease Control, filters down through the state and then filters down to the local jurisdiction. And we create our own public guidance, knowing what we know about our own populations, to be able to tell people what we think they ought to know. And that speaks to places like businesses. How are businesses going to operate in this situation? How are businesses going to open when we feel that the time is right? And that kind of guidance that needs to be provided locally comes through the Department of Public Health. And finally, I think we plan for the next thing, the next big thing. And so in thinking about how the country will recover, how people will go about their lives, what does new normal look like? It's our job to think about that and to put out to the public, to politicians, to businesses, to government, what we think it should look like, what we hope it will look like coming up in the future. So those are some of the things I just wanted to say about Department of Public Health and the work that we do.
Do you have any thoughts on how you think COVID might change how public health preparedness works in the future?
I think that right now we are certainly in the response phase. It's really hard to say what point in the future we will no longer be in the response phase. So, will that be a year from now? Will that be 6 months from now? Nobody knows that. I think at the point where there is a vaccine that is given to a large number of people, and that there is what is called herd immunity, that is, people are immune to it in enough of a proportion that they're no longer spreading, there's no longer community spread in the same way. I think that, I don't know when that will be, but that's when maybe we will go back to the kind of planning that we were doing. Now, having said that, there's all sorts of stuff that's going to happen in the meantime. A perfect example is that the number of children who are getting their childhood immunizations has fallen way down. And that's because people are afraid to go to their primary care providers and get those baby shots for their kids. But they need to do that. Given that they're not doing that, what does that mean for outbreaks like measles, which was a problem last year because there was a lower number of children who were vaccinated? Is that something that we're going to have to deal with in the future? I don't know. I hope not, but I certainly hope that people get back and do what they need to do to protect their kids.
Thank you for your time. I'm going to stop the recording.
Okay.
My name is Alexandra, and I'm a nursing student in Berkshire County. COVID-19 has impacted my work significantly. On March 4th, one of my patients happened to be the first patient in Berkshire County who tested positive for COVID-19. It wasn't until a week later that we found that information out. Because of that, I needed to be screened by the infection control, and I needed to meet with the head of the staffing department at Berkshire Medical Center in Pittsfield, where they did a pretty intensive screening of me, where I then posed as a low profile risk. Because of that, I was still told that I needed to stay away from the hospital for 14 days, stay away from people for 14 days, and take my temperature every morning and report it to the hospital. And if it was over 100.9, then they would instruct me to do further. Because of COVID-19, my clinical experience was shortened significantly as well. We were no longer able to attend clinical in the hospital. Instead, we were set up with a virtual simulation program that would allegedly represent a qualified clinical experience as best as they possibly could offer. It's been challenging and difficult, kind of feeling more so like a video game than a real life experience, but you kind of take what you can get. One thing I wish people knew about working with or during the time of COVID-19 is the importance of listening to healthcare workers, the importance of the severity of the statistics that have changed so drastically in such a short period of time. I don't believe it's anything to be taken lightly, and I do believe that following hand hygiene and social distancing is really the only way we can change or flatten the curve of this disease until we find a vaccine. How do I think COVID has changed things for me or will change for things in the future? I know I personally will not be giving handshakes. I'm all about elbow bumps now. And I think people might think differently about their social activities and attending certain events that might no longer seem necessary to the public simply because of infection control.
Hi, my name is Kristen. And my name is Katie, and we both just graduated from UConn a few weeks ago with our Doctor of Pharmacy degrees. And we want to share with you our experience working in healthcare during the COVID-19 pandemic. We both have been community pharmacy interns for the past 5 years, but these past few months really have brought challenges that we never thought we'd have to face. Our procedures changed a lot over the past few months. But what didn't change was maintaining the health and safety of our patients, our top priority. The first 2 weeks of the pandemic were very busy working at the pharmacy. We had a lot of patients coming in trying to fill all their medications in preparation for the coming weeks. And then on top of that, we had to implement many new, stricter cleaning protocols to ensure the safety of our patients and workers. So all these changes were challenging, but necessary, and we were able to find a new routine. Not only did COVID-19 affect our work, but it also had a significant impact on our last 2 months as UConn students. So as sixth-year pharmacy students, we were on our last year of clinical rotations, where every month we rotate to a different hospital or community pharmacy site for practical experience. So March was our last rotation, and we were both down in Florida working at a pharmacy down there. It wasn't until the second week of March that we really started to feel the effects of the pandemic on the pharmacy operations. The pharmacy turned to drive-through only operations and prohibited any patients from coming into the building. Unfortunately, we were only able to spend 2 weeks at the pharmacy working for the rotation, and we had to complete the rest of the rotation online doing projects at home. Students who had rotations for the month of April were assigned new rotations than the ones that they were originally scheduled, and these new rotations were with UConn faculty members to facilitate these online rotations to prevent students from having to go into the hospitals and other healthcare settings during the pandemic. Now that we've graduated, we both are going to be starting new jobs as pharmacy residents at local hospitals starting at the end of June. So while it is a scary time to be going into hospitals now, we're also ready to face the new challenges that come our way, and we're very excited to be able to work on the front lines in the pandemic alongside all the healthcare professionals that have been so graciously working and on the front lines, caring for the sickest of the sick in the hospital. And we want you all to know that we've seen the hospitals are putting a lot of different safety protocols and new policies and new procedures to maintain the safety and health of all their patients and employees. So if you or someone you know has an urgent medical condition that they need to seek medical care for, it is safe to go to the hospitals because there are a lot of safety protocols and procedures that are being put in place. I think COVID-19 is definitely going to change the face of healthcare because there's been so many new policies and procedures that have been put into place. For example, virtual visits and limiting capacities in offices. I think those will stay in place for some time. It's also great to see that the healthcare professionals are getting some much deserved recognition for all of their hard work and dedication during this time, as are all the other essential workers who are helping us get through this pandemic. We definitely couldn't get through it without them. And finally, I think there is some good to come out of these quarantine restrictions in that families have been spending more time together and have been brought closer together. We've been through a lot of emotional stress these past few months, and we've come to rely on our families to help us get through it. Our PharmD graduation was canceled because of the pandemic, which meant that all of our plans we had to celebrate with our friends and classmates were also canceled, and we unfortunately weren't able to say goodbye in person. So although we watched our graduation from our living room TV, what was most important is that we had our family there. So while it seemed imperfect, it actually was perfect. Thank you so much for listening, and we hope that you and your family and stay healthy during this time.